Dr. Paul here. Couldn't miss the opportunity to share another baby with you. All right. Hi, how you guys doing? Swabs, because I know we're looking at a belly button. Nice pair of gloves. I love blue. Blue is my favorite color. Okay, so this little one is how old now?
3 weeks.
3 weeks old, and we had goopy eyes. Was that about a week ago?
Yes.
And we started some, so for my viewers, I don't always treat goopy eyes. Sometimes we'll just do breast milk in the eye and often that takes care of it. But this little one had super goopy eyes. So we decided to do erythromycin ointment a couple times a day. And you know, for those of you wondering, how do you get erythromycin ointment in the eye? You usually would just get a little dab on the lower lid, like pull that lower lid down and just dab it on there. Oh, I know, I got you all upset. Checking the eyes. You can see some discharge on that eye. It's a little goopiness, and Mom just cleaned that eye this morning, didn't you?
The left.
The left one.
The left one. The right one's still pretty bad.
Yeah. So they're still gooping up a little bit. Now, one of the ways of trying to see, you know, is this an infection or a blocked tear duct, is looking at how angry red. Oh my goodness, you just don't want to be bothered. How angry red is the lower lid? So I'm looking down there, and that lower lid is slightly pinker than normal, but it's not terrible. Oh, I know. Okay. Oh, I know. Oh, I know. There you go. There you go. All right, that's better, huh? That's better. Okay. So the other thing we were going to look at today, so in this case, we're going to call this still a conjunctivitis or pink eye, and probably we've got some breast milk we can put in there. We've still got some erythromycin ointment, and I'm not that worried. We could do a little tear duct massage, which I'll show you. Now, I'm not sure this does a whole bunch, so but I want you to know how to do it, because the tear duct runs from the inner corner of the eye into the nose, and you don't want to put pressure on the eyeball itself. So what that would look like is a little bit of pressure right there on the corner of the eye, but I'm pushing against the nose, and I'm just doing a little downward sweep like that. Pressure only against the nose. So a little downward sort of twisting sweep. Oh, okay. There you go. I used a different finger, by the way, if you're like, oh no, he put that goop in the mouth. No, I didn't. That was this finger. My little finger's in the mouth to console. I know, you'd rather be drinking some milk, huh? Yeah. So we're gonna take a look at the belly button. This belly button has been gooping up, and we're at 3 weeks out. Usually it stops by then, and it was bleeding a little bit for the last 2-3 days, I think Mom told me. Yeah. So I'm gonna go ahead and clean it up with a sterile Q-tip and water, and then probably zap it with a little silver nitrate stick, and then we're done. Okay, so we've got some dried blood on this belly button that I'm just gonna clean up. And yeah, this is just a lot of old dried blood. Get that all cleaned up.
I think that even needs silver nitrate.
I'm not sure it does. You've done this before, haven't you? Big no. He's my videographer who's seen enough of these that he's wondering if it even needs to be zapped, and that is, I was wondering the same thing. Now, parents often get real nervous about sticking anything in there, and this is a sterile Q-tip, and you can see I've got about, 1/4 inch in there, and I'm twisting. That's not hurting anything. And I'm gonna pull it out, and there's a little bit of reddish blood on that. So because it's still red, I think I'm gonna just very quickly touch this with a silver nitrate stick. We're just gonna go in there, twist it, and we're done. That should prevent it from continuing to ooze, and also from getting infected. I don't have a very good smeller, but I did smell a little odor from this, which means it was probably good that we zapped it. Now it's coming off black. See that black? That's just the excess silver nitrate. Now this is a perfect demonstration of the fact that this doesn't hurt that much, because distracted eating, we had no problems. Thanks for watching. I'm Dr. Paul. You got to see pink eye, you got to see belly button that's bleeding and oozing and crusting, and we solved it with silver nitrate here. We're going to solve the pink eye with breast milk and maybe a little more erythromycin if we need it, and some massage of the tear ducts. I'm Dr. Paul. Thanks for watching.
What's going on here?
Oh, you like to find extras. So this is a birthmark, correct? Was that there at birth?
I think so.
Yeah.
It's just gotten darker.
So I'm going to push on it to blanch it, and you see how it goes away and then comes back? That means that this is vascular, meaning it is blood vessels that are superficial. Lost my bottle. Where's my bottle? Keep trying. All right, so when you have a superficial, meaning it's flat rash that blanches, so I'm pushing on it, and you can see how I can make the redness totally go away and then it comes back. And it was present basically at birth. These could even develop a little after birth. You can develop birthmarks that aren't actually totally there at birth.
Yeah, it was teeny tiny at
Right,
first.
so it's getting bigger. Yeah, it's possible this could grow into what's called a hemangioma. And I believe I have a video of a hemangioma that we'll put a link in the description for you so you can kind of see what it could develop into. The nice thing about hemangiomas, nice thing for parents to know, is that they almost always go away on their own. So they will grow for the first 6 to 12 or 18 months, and then by school age they're usually gone. So a birthmark that blanches, nothing to worry about. I am being given the signal from my producer to wrap it up, Dr. Paul. It was nice chatting with you today, and we'll see you next time.